Good morning, and thanks for attending. Today, I'm joined by Dr. Carol Zimbalatti, public health physician, to give an update on our local COVID-19 situation, and Andrea McLellan, director of COVID-19 Immunization Strategy, who will provide an update on the vaccine rollout. Today, I would like to take a moment to reflect on the courage and sacrifice of all those who fought for our country's freedom. At 11 a.m., please stand to take part in 2 minutes of silence to reflect, acknowledge, and honor all those who have fallen. I know that everybody is exhausted and fed up hearing about COVID-19 and just wanted to go away, but unfortunately, this Delta variant is stubborn and persistent. And while it will be with us for a while, we have proven we can control the spread if we all act together. By acting now, future restrictive measures may not be necessary, but we all have to do our part. So please don't wait to get vaccinated. Get vaccinated now. Vaccines are safe, they're effective, and provides the best protection available to keep you and your loved ones well. Vaccines help prevent our hospitals from being overwhelmed with COVID-19 cases, allowing vital treatments, tests, and surgeries to continue without interruption. Please continue to follow public health measures that have proven to be effective and have kept our district case numbers low. Wear a face covering when required. Practice physical distancing. Wash or sanitize your hands often. With cases on the rise locally and regionally, think twice before traveling or going to venues with large gatherings, even if capacity limits are permitted by law. In response to the increase in individuals testing positive for COVID-19, increased COVID-19 public health measures have been put in place by public health Sudbury districts in the city of Greater Sudbury. The increase in individuals testing positive for COVID-19 in our neighboring region is very concerning. Public Health Sudbury District has advised against non-essential trips in the Greater Sudbury area. This recommendation would also apply to residents of our district considering travel to Greater Sudbury. So please consider the risk and the necessity of your visit before traveling to that area. This is especially important if you are unvaccinated or only partially vaccinated. This puts you at higher risk of getting COVID-19, becoming seriously ill, being admitted to hospital and to the ICU, and possibly dying from COVID-19. As we've seen with the Barkley outbreak, the COVID-19 situation locally can change quickly, and it is important to determine if a non-essential trip is worth the potential risk of being exposed to COVID-19, becoming ill yourself, or passing it on to your loved ones. For those who do choose to travel, again, I encourage you, be vaccinated, wear a face covering when required, practice physical distancing, and wash or sanitize your hands often. It is very important that anyone who feels unwell stay home and arrange to be tested for COVID-19. There is no way to know if your symptoms are a result of COVID-19 or not without a test. Last week, we announced an outbreak of COVID-19 at Chartwell Barkley House retirement residence. As of yesterday, at 3 p.m., 41 people have tested positive for COVID-19 in association with the outbreak. 36 are residents, 4 are staff, and 1 is a visitor. We continue to work with Barkley House to help ensure that case and contact management is completed. So with that, I'll pass it over to Dr. Zimbalatti.
Thank you, Dr. Chirico, and good morning, everyone. In the last 7 days, we had 33 new cases, bringing our total case count to 862, with 611 in the Nipissing district and 251 in the district of Parry Sound. The health unit currently has 50 active cases. Currently, there are 2 individuals in hospital who have tested positive for COVID-19. Since June 1st, 55% of individuals eligible for the vaccine who tested positive for COVID-19 were unvaccinated, while 18% were partially vaccinated. 27% of cases have been identified as breakthrough cases, meaning individuals who have tested positive for COVID-19 were considered fully vaccinated. As we continue to monitor the COVID-19 outbreak at Barclay House, surveillance measures remain ongoing, including regular on-site COVID-19 testing by the North Bay Regional Health Centre's Assessment Centre to monitor for new cases among staff and residents. Additional infection prevention and control measures remain in place. As a reminder, individuals who attended Barclay House between October 20th and November 3rd, 2021, and who have not been contacted by the health unit, please continue to monitor for symptoms of COVID-19. If you feel unwell, isolate immediately and arrange to be tested. We will continue to work with the facility and communicate with the public as required. Case numbers for the outbreak will continue to be updated Monday to Friday through our status report COVID-19 dashboard on our website. Now back to you, Dr. Chirico.
Thank you, Dr. Zimbalatti. Now I'll pass it over to Andrea McLellan, please.
Thanks, Dr. Chirico. Good morning, everyone. As of yesterday at 3 p.m., we are now at 86.9% of residents 12 years of age and older who have received at least one dose of a COVID-19 vaccine, and 82.9% of residents 12 years of age and older who are fully vaccinated. Currently, the age group with the lowest vaccination rate remains those aged 18 to 29 years of age, with only 74% who have received at least one dose and 67% who are fully vaccinated. That means 1 in 4 have yet to receive a dose of COVID-19 vaccine. If you know someone in this age group, I encourage you to have a conversation with them about being vaccinated. They can also call our call center at 1-844-478-1400 if they have any questions about the vaccine. 82% of youth 12 to 17 years of age have received at least one dose of a COVID-19 vaccine, and 75% are fully vaccinated. As of yesterday at 3 p.m., a total of 194,378 vaccinations have been provided in our district. The current target remains to achieve 90% vaccination rate for both first and second doses. To achieve this, we need to administer 3,596 additional first doses and second doses to those who have received no vaccine, as well as 4,597 second doses to those who have already had their first dose. On Saturday, a number of individuals became eligible to receive a third dose after 168 days after their last dose. This includes those aged 70 years of age and older, born in 1951 or earlier, people who received 2 doses of AstraZeneca or 1 dose of the Johnson & Johnson vaccine, adults in or from First Nations, Inuit, and Métis communities and their non-Indigenous household members, healthcare workers, and designated essential caregivers in congregate settings, including long-term care homes and retirement home staff and designated caregivers, residents of long-term care homes, retirement homes, First Nation elder lodges, and other individuals living in elder care settings. It is important to remember that it must have been at least 168 days since your last COVID vaccination for you to be eligible to receive your third dose. Even though you may fit into the list of eligible individuals, if you haven't waited the 168 days, you will not be eligible to receive your third dose yet. I encourage everyone to book an appointment for the COVID vaccine to prevent having to wait in lineups. Appointments can be made online or by calling our call center at 1-844-478-1400, and we can provide assistance for booking that appointment. Now back to you, Dr. Chirico.
Thank you, Ms. McLellan. So that ends our remarks, and I'm going to turn it back to Alex for questions. We'll try to answer as many as we can. If we don't have the answers, we'll get back to you, and just put your name associated with the question if you can. Thank you.
Thank you. Our first question is for Dr. Chirico. It comes from Eric Tashner from CTV News. How concerned should we be seeing the amount of cases in Sudbury growing?
Yeah, thank you for that, Eric. As I mentioned in the remarks, I am very concerned, and I think that we all need to be And I think we need to make decisions based on what's going on around us. We're seeing increases in cases throughout Ontario, as would be expected with sort of increasing things, and we have to find that balance. So let's look at it, look at your personal risk that you have as far as whether or not you decide to where you want to go. So in Sudbury, we're not recommending people travel there except for essential reasons only.
Thank you. Our next question is also for you, Dr. Chirico. It comes from Stu from Bay Today. Are there any parallels between the Barkley House outbreak and the Skyline Lancelot outbreak? What have we learned?
Yeah, it's a very good question. Thank you for that. I think that we have to look at the different settings in that both are congregate settings. So you've got a large number of people in a building where there's greater interaction. So you have increased risk of potential spread. I think that what we have learned too is that you have the conferences that are made available every week or every 2 weeks, depending on the situation, and being able to be as transparent and with the public and the media to keep you updated on those. I also think there's a difference in that back then, not all people were vaccinated, and we know that with this outbreak, with the people that are most vulnerable, especially in a retirement home, that the vaccinations have proven to be very, very helpful in the situation.
I'd also like to add too that we continue to work with Chartwell Barkley House Retirement Home in terms of implementing control measures and then monitoring. So there is a better ability to be able to monitor the situation in this environment than there was in the Lancelot Skyline type environment. And obviously, vaccination status is something that is different as well. Vaccinations were quite a new we're just being introduced at the time of the Lancelot outbreak, and we did manage to get offer vaccinations to residents of that building during the pandemic, during the outbreak. But in this case, the residents are largely already vaccinated and just became eligible for their third dose and were given their third dose.
Thank you. Our next question is for Dr. Chirico. It comes from Sarah Bissonnette from the North Star. Since October 1st, the percentage of new cases involving those fully vaccinated has increased from 10.82 to 26.25%, with the percentage of new cases involving those not vaccinated has dropped from 66.42% to 55.46%. Yet, the fourth wave has been described as the wave of the unvaccinated. How do you explain these numbers to the general public?
Well, it's a very good question. Let me start in general. In general, we do expect that there are going to be breakthrough cases. Nothing is 100%. We know that that's going to happen, and that is exactly why there's been ongoing surveillance with these vaccines, and especially in the vulnerable populations, which is exactly why we had moved to a third doses for those that are most vulnerable, the ones with the elderly, those that have compromised immune systems. And that's where we were seeing the slow decline in the vaccine waning immunity was occurring. So that is something that is expected. And if you look at, and the reason that people are saying that this is the wave of the unvaccinated, very much is because what we're seeing is the more severe illnesses are occurring in the unvaccinated or partially vaccinated. If you look at hospital admissions, if you look at ICU admissions and deaths, those that are fully vaccinated, it's associated with a significant reduction. For instance, about 82%, there's a reduction associated with full vaccination of just getting COVID-19. There's a 94% reduction in fully vaccinated being hospitalized, and over 97% reduction if you're fully vaccinated of ending up in the ICU. So the vaccines are effective against severe disease, and if you are unvaccinated, you certainly are at higher risk.
I think
and Dr. Zimbalatti will probably have something she will want to add.
Yeah, I think it's important to remember too the proportion of unvaccinated to vaccinated individuals at this point. You know, our population does have a very high vaccination rate, and we're looking, you know, between 85 and 90% of the 12 plus population in Ontario is now vaccinated. Yet they still represent a minority of the cases that we're seeing. So proportionately, the unvaccinated do represent a drastically higher rate of cases than the vaccinated do. It's just that the unvaccinated are a smaller percent of the population at this point.
Thank you. Our next question is for Dr. Zimbalatti. Are either of the cases in hospital from the Barclay House?
There are 2 individuals from Barclay House currently in hospital, yes.
Thank you. Our next question is for Andrea. Are you still optimistic you can reach the 90% target before the end of the year?
That's a great question. Thank you for that. We are seeing a decline in the number of individuals presenting to our clinics for immunizations, both for first and second doses, and that impacts the target goal for sure. But having said that, we are still seeing people coming to the clinic for their first and second doses, although the numbers are smaller. So time will tell. We encourage people to continue to come. We are trying to make clinics available and accessible for individuals to ensure that they have the opportunity to be immunized, and hopefully we will still obtain that target by the end of the year.
Thank you. Our next question is for Dr. Chirico, comes from Stu from Bay Today. As a follow-up, can you say for certain we would be seeing much more grave outcomes at Barclay House without the vaccine? There is a sense the outbreak has been spread by asymptomatic individuals who don't know that they are sick due to vaccination.
I didn't quite catch the last sentence. Could you read that again, Alex?
There is a sense the outbreak has been spread by asymptomatic individuals who don't know they are sick due to vaccination.
Okay. First of all, you're not always going to know what the initial cause of an outbreak is and where it started and how it was disseminated. What we can say is that, yes, we have noticed a significant difference because of the residents being vaccinated. And I think you should also keep it in mind, while we're trying to be very careful not to disclose personal health information, I think you got to be very careful not to assume that because somebody was admitted to hospital, that it was COVID related. May or may not be. I hope that at some point when the outbreak is over, we'll be able to provide you more information, certainly as to what we believe is occurring as far as, yes, we think that there's a significant impact with vaccinations in lowering the severity of the disease. I'm highly confident in that right now, but again, we need to wait until the outbreak is declared over before we can say for certain. But that's a very good question. Thank you for raising that point.
Thank you. Our next question is for Dr. Zimbalatti. Is there any indication yet if there are many long haulers of COVID-19 in the region?
I'm not sure who that question was from, but thank you for the question. Public health doesn't manage the cases for that duration of period. So once the case is declared resolved, meaning a certain number of days have passed since the individual tested positive or developed symptoms, we no longer follow them. So locally, we don't really have a sense of how many long haulers from COVID there are. I think that would be a question more directed to acute care. However, I think the data collection for that would be difficult as well. I think we do have to look more to provincial numbers and even national to get a sense of what the proportion of long haul is. I also wanted to say that likely in children, you know, that's a question too. Are children affected by long haul COVID? Though there are some estimates of that, and anywhere from 1 in 4 cases to a much smaller percentage. I think it's difficult to get a sense of that condition in children just because of the difficulty in them reporting symptoms. So there may be an underestimate of long haul COVID in children based on their inability to really describe what they're experiencing.
Thank you. So that completes all of our submitted questions. So that will conclude today's press conference, and we will see you next week back at 10 a.m. For our regular scheduled press conference. Thank you.